Hello, my name is Megan. I'm a nurse practitioner here at Breathe America, and I work hand in hand with Dr. Grenzer on the ENT side of the clinic. And I want to talk to you guys today about something that we do in the office called phenol chemical cauterizations. This is an in-office procedure that we do that's basically non-invasive, and it helps our patients that tend to suffer from day-to-day symptoms due to chronic rhinitis, and it helps a lot of our patients that tend to suffer from recurrent sinus infections. So, how does this treatment work? What this treatment is, it's a series of sprays that we place into the nose. We start with a decongestant first, kind of open up all the nasal passages, and then we use phenol, which is actually an antiseptic, and it helps to reduce the mast cells, which are the cells in the lining of the nasal passages and sinuses that release histamine. Histamine, as most of you probably already know, actually causes a lot of inflammation and irritation in those passageways. And that can set the stage for a sinus infection to begin with, and it can actually cause a lot of your day-to-day symptoms if you suffer from chronic rhinitis. So by reducing those cells, you reduce your day-to-day symptoms, and hopefully in turn reduce the amount of sinus infections you're currently experiencing. The third spray that we use is something called alcohol. And this actually has a soothing property, and it helps to improve the self-cleansing properties of your nose. And then at the end, we place peppermint oil into the nose, and this is also soothing towards the end of it. Is this treatment permanent? No. So the way this treatment works is we start with a series of 3 treatments, about a month apart. If after the series of 3 treatments you feel that you've gotten some benefit from this, we typically resume the treatments, but we stretch out the time interval in between the treatments. The goal is to get you to 1 treatment every 6 months. That does kind of vary according to the patient and how severe their symptoms are and when they feel the symptoms are returning. So you do need boosters periodically after the series of 3 treatments. Another question I commonly get asked is it painful? This treatment is relatively painless. Some patients do say that the phenol can sting slightly, but most patients tolerate it very well. And if anything, usually over-the-counter analgesics will take care of any side effects that they feel from this. The success rate of this treatment is typically about 80% for patients. I personally really like this treatment because it's not invasive and patients tend to respond really well to it. So if you feel that you or someone that you know would benefit from this type of treatment, feel free to call our office, and myself or Dr. Grenzer will be happy to evaluate you. Thank you.